Hi, my name is Colleen Kupka, and I'm at Rejuvenate Hormone and Weight Loss Center here in Scottsdale, Arizona. I'm a nurse practitioner, passionate about hormones and education, and I also work with patients on nutritional diet stuff, right? Plant-based educator, so that helps a little bit. Anyway, what I want to talk about today is I want to talk about testosterone and Parkinson's in men. In the future, I will be talking with women on how hormones may also help them through Parkinson's. So the title is Can Testosterone Help Parkinson's? And What Most Providers Miss. You know what? I do think there's a miss. And the reason is this. Us providers, it doesn't matter if you're a doctor, nurse practitioner, PA, we're not trained about hormones in school. It is something you have to go off, train yourself on, and over again to get any good at it, really, to be truthful. So not taught about it at all. So when you walk into your primary care office and let's say you have Parkinson's, is the practitioner going to be thinking about hormones? Probably not. They're not even going to correlate it because they don't know. Or they've gathered some opinions throughout the years that may not be, you know, all that right or correct. So I think in time that will change, but for right now, that's where it is at. So let's talk about low testosterone in general in men. How do you feel, right? And see if you relate. So anxiety, depression, brain fog, fatigue, endurance, not where it used to be, not getting to the gym, not having muscle strength. Maybe your gait's changing a little bit. Libido's lacking. Relationships are lacking because you just don't feel like dealing with them. The only thing different may be the fact that you're missing the tremors, right? So add that in, your feelings and what you're going through may not be the Parkinson's. It may be the fact that your hormones are lacking. Will testosterone cure Parkinson's? No, it will not. However, it can make a huge difference in your life. It could be a game changer, right? Huge game changer. Now, you know what? I want to tell you, there are a couple studies out there. In fact, a study from Emory University found that over 35% of men with Parkinson's had low testosterone, levels below 325. Let me tell you, if your level is below 325, you're not feeling good. It may say on that lab form that you're fine. You're not feeling good. Clearly it's deficient in the range. Um, there's another study published in the Archives of Neurology. It looked at testosterone therapy in men with Parkinson's. While it didn't change motor symptoms, it showed clear improvements in verbal and memory working, and mood. So here's the big takeaway. If a man is dealing with fatigue, brain fog, or loss of drive, it may not just be the Parkinson's again. It could be totally hormonal related. The cool thing is it's fixable. It's very fixable, and it can make a difference in how you live with it. And here's something more exciting. Testosterone reduces inflammation. And as you may already know, Parkinson's is largely driven by neural inflammation. So optimizing testosterone isn't just about symptom relief. It may actually help your brain function better by calming the inflammation that fuels the disease progression. So here, this is where a lot of men get dismissed. You walk into your provider's office and you're telling them, hey, I don't feel all that good. You list the symptoms that we were just talking about. They take a look at they go, let's get your labs, take a look at them. The labs come in and they go, well, they look just fine. They look just fine. And you get dismissed. And that is the reason. You just get dismissed because they think you're fine. Your testosterone is normal. But normal doesn't mean optimal. And it sure doesn't mean you're thriving. Here's how I see it. We don't treat numbers. We treat people. We treat symptoms, lab values. They're a baseline. They're a guideline. They're not you. They're not your energy. They're not your motivation. They're not your relationships or your quality of life. So if you're feeling tired, foggy, disconnected, or just not feeling like yourself, it's time to dig further because numbers don't tell the whole story. You do. In my practice, I've seen it firsthand. Men with Parkinson's or not who have low testosterone, their spark was gone. They thought that their spark was gone for good, who felt foggy, who felt flat, who felt stuck, start to feel alive again once they start treatment. more focused, more stronger, more engaged in their lives, in their relationships. And that's the power of looking at the whole person, not just the diagnosis. So if you or someone you love is living with Parkinson's and just feels off, don't assume it's just the disease. Don't assume it. And maybe your hormones. Hormones matter. Inflammation matters. And testosterone might be the missing piece. If this resonates with you, give me a call, 480-589-3999. I offer free 15-minute consults. We can talk about what's going on, see if you think that hormones might help. And if you do, we bring you in, we get your labs and go from there. But let's take a closer look because you deserve to feel like you again. And if you or someone your love is facing Parkinson's, know this, you're not alone. You're not alone. And there are options. At Rejuvenate Hormone and Weight Loss, we offer personalized hormone care. I have a concierge practice. So it's between you and me, not a lot of staff, no time sitting in the waiting rooms, that kind of thing. I offer telemedicine too. But we work on brain health, reducing inflammation, and improve quality of life. When I'm sitting here thinking about all this and why I really came today, number one, Parkinson's is in our family too. And number two, I'm out here searching these Facebook pages and looking what people are saying, how they're treating, themselves and all that. Everything comes up but hormones. I don't get it. I mean, I think there are some really good things like B1 therapy, light therapy, and all of that. However, I think we are missing it if we're not looking at our hormones. You can't see them. You don't know. Why am I feeling so bad until you get your labs checked? Okay. It's just the way it is. Hormones are weird. I mean, we can't see them like anything else. We have a broken arm, we know it's broke. But hormones, you don't know that until you get tested. So anyway, check out my website, www.rejuvenatemyhormones.com. And, if you'd like to call in for that free 15-minute consult, I welcome you to do it. Let me know what your thoughts are about this video, and if you're suffering from Parkinson's, do you find the symptoms similar? I guess you do. And we're certainly here to help. Anyway, cheers to rejuvenating your hormones and weight loss. And I will talk to you on the next video. Okay, take care. Bye-bye now.